Good evening, everyone, and welcome to Let's Talk with Tammy, brought to you by Beginner Resources. Beginner Resources is a comprehensive consulting company in working with individuals, businesses, schools, government, and organizations. They have a 10-year long track record in conducting seminars, workshops, and individual series on personal branding and appearances. For those of you who are tuning in for the very first time, this show features interesting personalities from all walks of life, sharing profound insights into relevant topics. I'm Tammy, your host, and the basis for this show has always been about sharing my personal journey in getting to learn anything that piques my curiosity. So, tonight's episode created a bit of buzz. Was that a pun? But seriously, this couldn't have come up at a better time. What with the Libresse ad campaign fiasco, I think we really need to talk about sex and often and in a healthy manner. So I would like to also shout out to Jane and Young, my friends. They were the one who suggested this topic a couple of months back as I was just talking to them about what are the topics that we might want to cover this season. So before we go any further, let me bring my guest into the stream. Hello, Andrea.
Hello, hi Tammy.
Okay. Thank you so much for being here tonight.
Yeah, thank you for inviting me, and I'm very excited to be here.
Okay, I'm very excited as well. But before we start, I would like to introduce Andrea to our viewers. So Andrea is a passionate advocate for sex education and mental health. She's currently pursuing her second master's degree in professional counseling, currently in her final year. She also has a master's in sexology from Curtin University, Australia, and majored in psychology from Sunway University. She's currently working at Vibrance Pelvic Health Center with more than 3 years of experience working with individuals and couples with sexual health issues, especially vaginismus, and she's actually trained to help her patients to overcome with this condition. So before we start, I would like to remind everyone, to those of you who are currently watching, we are live on Facebook and YouTube. So if you have any questions at all, feel free to drop them in the comments section. I'll be sure to share them on screen for Andrea to address them. So Andrea, my first question would be, I think a lot of people have that question as well. I'm curious to know what made you choose sexology as your major.
Okay, so yeah, I also get this question a lot actually. So it's kind of a long story or like a journey to this discovery, but I just shorten it a bit for today's session. So basically, I've been interested with this sexual area since high school, because I think maybe because the place that I brought up with, like I come from Sarawak. So the school that I went to is not really rural, but you have like a lot of the students, they are those underprivileged family. So, like those type of school, you will see a lot of social issue like gangster fighting, bullying, teenage pregnancy, sexual harassment, and so on. So basically, I see a lot of my friends. I know few friends who actually got pregnant and then they need to quit school and got married at the age of 15. And I feel like it's so unfair. Like, why is this happening to us?
Right.
And why no one is doing anything about it? And I remember like, I tried to ask teacher about certain question on like sexual things, and no one really want to answer. Even the teacher just ignore us. And like it's not like young people don't talk about it. Like we actually talked among our friend about like sex stuff actually, but of course like hush like what you said, like hush style like that. So basically there's no other way for us to get information. And last time internet is not that advanced yes during those times. So like where else can we get information? So that's where I started to realize like sexual knowledge is actually very important to protect myself actually, since no one can protect me from whatever sex is around. So I try to educate myself about sex more often, and I also try to educate my close friends, colleagues, partners that I have as well. So when I graduated from my undergrad, I was actually trying to apply for Master of Clinical Psychology, but I didn't manage to get in because my result wasn't good enough. So while I was browsing Curtin website, then I noticed that, they have this course. Like, I was super happy they have this Master of Sexology. Then I was like, okay, let's try apply for it. You never know if you get it. And I actually apply it without my parents' knowledge. And I managed to go in. So when I got in, then I told my parents, I was like, I actually applied for this master instead of clinical side because I can't get in, like they rejected me. And I need to like explain, took a while for me to like explain to them, make them convinced that why this master is still okay to take. So I'm quite lucky in that sense that my parents willing to support me to study this course, to support me to choose this career, even though it wasn't something they preferred, like it's not their first choice, like who have in mind that they want their kids to do sexology or even like sex related kind of topic.
I know, right? Yeah.
I remember my dad was saying like, it's fine as long you get a job after this. You study whatever you want. He literally said like that when I wanted to study this, and then my mom was like, I'm not going to tell anyone you're studying this. I'm just saying you're studying Master of Psychology. Like that was her reaction at first. But now, now they're a bit more open about it. Like after I start sharing what I do in Libresse, and I especially now I'm doing counseling as well. So now they're a bit more open in seeing how my job actually can help people, couples to improve their sexual relationship. Yeah. So very long story.
Yeah, I mean, but which is totally understandable considering the kind of society that we are in. I think the fact that your mom said, I'm not going to tell anyone that you're studying this, it's like that's literally Asian community in a nutshell, basically.
Correct.
So you told me that, you've been doing work at Libresse and how that opened up for your parents to be more open to what you're doing. So what do you do as a sexologist? Is it the same as sex therapist, for example? Because there is another job that you call.
Yeah. So basically, I'll just define a bit what sexologist is. So sexology, the course of sexology is actually referred to scientific study of human sexuality. So basically, as a sexologist, we are sort of like specialized in human sexuality. We have like specific knowledge and skill about that. So we help people, like we study people's sexual behavior, feeling, interaction. Then we help them reconcile with any issue they have about their sexual experience. So the aim is basically to improve their life. A sex therapist is they help people with sexual problem, and usually sex therapists, they have other qualification as well, like counselor, maybe psychologists, doctors, other healthcare professionals who have like extra training in like sex therapy certs. So that's why they can call themselves as sex therapy. So there's a bit of the difference between that two.
Okay. So I think based on how you have been explaining about sexology and how you're explaining about, making people to understand about their sexuality and things like that. So for you, how would you define a sexually healthy person?
Okay, so I will quote a bit from from the WHO. Sexual health is like a state of physical, emotional, mental, and social well-being in relation to sexuality. So a person who have a sexual health, healthy sexual health, it basically means that they feel positive, they feel respectful they feel respectful around sexuality, sexual relationship. Like there's a possibility of pleasure and safe sexual experience, no, like free from coercion, discrimination, violence, things like that. So basically, is to know that you have the sexual rights to be who you are, to have your sexual needs and things like that. So that is a person who is like considered a sexual, healthy sexual person.
Okay. And could you also elaborate a little bit about, because you say you specialize in vaginismus, right? So what is it about? Can you elaborate what this condition means? Is it psychological? Is it physical?
Okay. Yeah, sure. So this is something quite common as well, actually. Like a lot of people doesn't know that this condition exists. So vaginismus is a condition that happens to women or people with vagina who experience difficulty in having like penetrative sex. So this could be caused by many factors, but the main factor that I noticed among our clients is more like they are afraid or they're anxious towards penetration or towards sex in general, or maybe they have like the fear of pain or they experience pain during attempting penetration. So it stopped them from doing that activity. And one thing about vaginismus is not just stopping them from having intercourse, it actually makes it harder for them to have baby because even if you want to go for IUI, IVF, or this kind of thing, you need to go through medical procedure that involve inserting something into the vagina as well. And gynae checkup also will be difficult, even like pap smear. A lot of them having difficulty with that. So anything related to our vagina is difficult for them. Yeah.
Okay. So why does this happen? It's simply because they are afraid. They are afraid and they have this some sort of apprehension. So that because of that, it just clamps up. Is it?
Yeah. So it's something like that. So it can be both psychological or physical, or could be just physical, or could be just psychological. So basically, psychological, when we are afraid of something, our body have this fight response. So it's the same thing with our vagina actually. If we experience some pain before, like maybe first time attempting and you feel painful, your body, your muscle actually remember that pain. Even though you feel like I'm okay, but your muscle remember it. So the next time you try again, your muscle is the one contracting and tensing up. So without us realizing it. So that's why some people define vaginismus as also involuntary spasm of the muscle, because your muscle actually reacting without you controlling it. Yeah. And then there's another version is more like those who have some trauma from maybe sexual abuse, some physical abuse, and then this also make the body start to shut down whenever penetration start to happen. And also some of them have like negative thought about sex, like they think that sex will always be painful, sex will make them bleed and things like that. So that also stop them from trying or attempting sex, because the anxiety is very high. So yeah, there's a lot of reason actually for it to happen.
So these are all psychological, right? So is there like physical reasons?
So physical is mainly the muscle. So like just now when I explained, like our muscle has the memory, right? So it's mainly what we call is the pelvic floor muscle. So some people this concept might be new to some people. So pelvic floor muscle is actually a muscle that holds our bladder, our uterus, and also our rectum. So it's the muscle that is like, it's basically like a trampoline, like a hammock or trampoline. So it actually holds our organ, and it also controls our vagina. Basically those muscles that you feel like you feel your vagina loose or you feel your vagina tight, those kind of feeling is actually caused by the pelvic floor muscle. That is the one controlling it. So so for those people who have very tight muscle, very tense muscle, or if you are stressed, right, sometimes your muscle will start to become tense. So that's why you might have the physical symptom as well. So maybe you're not scared, maybe you're not scared or anxious, but your muscle maybe is too tight, your muscle is too tense. So that could be another reason as well.
Okay. So what kind of treatment do you provide to treat this condition?
So at Vibrance Pelvic Health Center, we provide consultation and treatment for this and also for other sexual issues. But for vaginismus, we actually offer combined approach. So basically, we have sexual therapy, which is done by me, and physical therapy is done by our women health physiotherapist. So because research actually found that combined approach is the most effective way in overcoming vaginismus. So it's like dealing with the mind and the body together. So it's not just dealing with one area. So if you deal with both areas, your mind and your body, it's a bit faster and it's help as well in terms of long-lasting overcoming this as well. Because sometimes when you just deal with one area, if something trigger it back, you might get it back again. You might get vaginismus again. So we try to combine both methods so that hopefully with anything that happen in the future, so you will still able to learn all this method on how to overcome it. Like maybe after pregnancy, after delivery, you get vaginismus again, which could happen. Actually, we have clients like that who get it after delivery. So you can apply what you have learned during when you came to our center. You have applied how to make your body and your mind work together again. Then it will help you with your journey again to healing from this.
Okay, so you have two kinds of therapies, which is like physical therapy and also sexual therapy, right?
Yes.
So what do you do in sexual therapy?
So basically for sexual therapy, I do more sexual education and also to understand what other thing that basically what other obstacle or challenges that is stopping the couple from having intercourse. Is it anxiety? Is it fear? Is it maybe just sexual communication? So sometimes just communicating with your partner, just telling your partner your needs, telling your partner how to satisfy you, how to pleasure you. Usually just by having that, they already can overcome it. So sometimes it's just simple things. Sometimes it's just simple thing, but sometimes it's those like really high anxiety, maybe from some past experience that they have, maybe with previous partner or whatever trauma. So those will take longer time for me to go through a lot of other methods, to counseling method as well. So because I learned counseling now, so I also apply some counseling technique inside as well to help them overcome their anxiety towards towards this fear of penetration. It's a bit like phobia as well, like dealing with phobia.
Right. And what would the physical therapy entail?
Okay, so for physical therapy, the physiotherapist we actually, we call this desensitization method or exposure therapy as well. So it's part of exposure therapy where we actually do like sensitization. We teach them deep breathing. We teach them some massage. So we teach some external massage on how to relax the muscle externally. Then we also do some internal massage or some exercise internally to relax the muscle inside. Because certain vaginismus, certain client with vaginismus, they have like tightness outside on the external part. So we teach them those exercise and it's easier for them to have penetration. But some, they manage to enter a bit, but inside is a bit tight. So we help them with the massage inside as well. Yeah, and then our physiotherapists also we help with Kegel. So Kegel exercise is also something we quite experienced in doing as well. So Kegel exercise, usually people listen to Kegel exercise, they will think about tightening to help tighten their vagina, to help with urine leaking and things like that. But it also helps with vaginismus, but the problem is we do the opposite. We do relax Kegel as well. So one thing about Kegel exercise, if you do it wrongly, you may end up making it worse. Either you're making it too tight or you might accidentally make it too loose as well. So that's where having proper guidance for Kegel exercise is also quite important. Like a lot of us think that we can just learn from YouTube and read about it, but we don't know where's the muscle actually, or we're not sure are we squeezing the right muscle when we are doing it. Yeah, so that's where our physiotherapists will actually help and guide you and making sure that you are actually squeezing the right muscle and not your buttock or your tummy, things like that.
Right. Okay. So do you think a lot of this issue, there are sometimes issues because of anxiety, issues because, past trauma and everything. But do you think some of the issue is also because women don't know their bodies?
Yes, we do have that as well. So I do, it's not surprising actually, like we do have, like just because we learn biology or science subject during our secondary school or maybe in college, right? Actually, a lot of people are still unaware about their own body. Like a lot of the clients that come to us, those who have very high anxiety or very anxious about sex, they're actually very anxious about their own body as well. Like some of them not comfortable, like some of our clients not even comfortable looking at their own private area. Like if you ask them, like, have you how do you feel when you touch your area, like when you're washing and things like that, they're like, no, I'm not comfortable, I feel disgusted about it, I don't feel it's pretty, I feel it's dirty, like that kind of perception. So it's like if you are not comfortable with your own body, if you don't like your own body, especially that down part, your private part, then how are we going to expect we allow other people to actually like us or look at us and touch us if we are not, if we don't like our body, we wouldn't want other people to touch our body if we don't like our own body, basically. It's actually quite common actually that a lot of people not really aware about it.
So once they go through your therapy session, do you see improvement about, having to accept their body? Do they have a higher level of body positivity?
Like that? That's one goal of Vibrance actually. So our goal is to make sure to help women to actually be empowered, to feel confident with their own body. So usually the first few sessions, we actually focus on that. We don't straight away like, okay, let's try to see if you can penetrate something. Like, no, we won't do that. But we actually focus on empowerment to make them feel comfortable. Like we do mirror therapy. So whether they are comfortable looking at their own vulva, and then can naming all the body part, and then comfortable touching it without feeling like disgusted, anxious about it. So we do those steps first before we actually start with more treatment after that. So that is the first thing we do to make client comfortable with that. And then also we make sure that if their husband looking at it also, they are comfortable with it. Because sometimes they are comfortable themselves, but when their partner want to look at it, they say like, no, cannot. Like. So yeah, so those things, we will do those things first before we actually go deeper in the treatment session.
Right.
Actually.
So when you do therapy, do you do like one-to-one, or do you ensure the partner is with the person
so
as
usually we do recommend to bring your partner along, because it does help. So sometimes our partner don't really understand like, why is this happening to her, like it's just so simple, just sex. Like some people think it's like that, like, but they don't understand that for women, especially if we have been always received negative things about sex, like I think almost all of us receive negative stuff about sex as a woman. Like for me, that's what I get as well. Like there's no positive thing. Like people never say anything positive about sex. So for those who have a lot of those negative thoughts, right? There we take some time. So their partner sometimes don't understand that it is because of those few things that actually influence them. So actually we do encourage to bring your partner. We can help you explain to your partner why is this happening, what he can help as well. Because actually if you have your partner along for the treatment, it helps the journey to heal faster as well. Because then, because we only can teach like few things, like you can do this. But after that one, maybe before the next session is like 1 week gap. Basically, other things all up to you to do at home with your partner, with yourself. So that's why we do encourage to bring your partner along. At least you can learn something here, then you can go back home and continue practice. The more they practice, the faster also the process. So we do our part to guide you, to help you, but you also need to do your part in doing the exercise.
Right. I remember 2 days ago when we were speaking and you were talking about how a lot of people still do think that sex is just penetrative sex. And when that doesn't happen because of these kind of conditions, they just stop. They don't do anything else. And that goes on for years, to the point that even the intimacy level between the couple, just go down the drain. So what do you have to say about this? Like, is sex just penetrative sex?
Yeah, so basically there's a concept, that we usually think that sex is only penis inside vagina. Basically, that is what we, penis inside vagina. Basically, that's what we think sex is. But actually, sex is more than that. It's anything that gives us pleasure, give us arousal, even touching, kissing, the foreplay, oral sex, like everything is actually part of sex. It doesn't have to be just penetration, and we can get sexual satisfaction from anything, from other activities as well. Like it doesn't have to, like, just because you don't have sexual penetration doesn't mean that you fell in sex, doesn't mean that you didn't have sex. Did you enjoy? If you enjoy the process of the sex with your partner, do you enjoy your being naked with your partner? Like those kind of things. If you do enjoy that means you have some positive experience, even though it doesn't lead to sexual penetration. So the main focus, a lot of people, when they focus too much on the outcome, basically the outcome, the goal is I need to have sexual penetration. If not, means I didn't have sex. So that's where you put too much pressure. We put too much pressure on ourselves to reach that goal. And then when we don't reach that goal, then what do we feel? It's same like other goals. When you don't reach your goal, you will feel sad, you will feel disappointed with yourself, and you feel bad about yourself, you feel guilty, and all these kind of things start happening, right? And actually all these things affect your next performance. The next time you have sex with your partner, all of these thoughts start coming back again. Then
the anxiety just compounds and compounds.
Yes, so it actually worsens the next time, the next attempt actually, because you start having all this thought of memory of what has happened, what has failed, and you just worry that all of this happened. When you worry all of this will happen, it will happen again, and maybe faster. Like before you even want to start doing it, you already feel nervous. Like some husbands actually told us, like, because they have been in this relationship with the vaginismus for like maybe 3-5 years. Even the husband having anxiety after that, because he don't want to hurt the wife. He's scared seeing the wife in pain, and then he worried about his own erection as well after that, because like very hard, need to make the wife comfortable first, need to make my partner comfortable first. So when by the time my wife is comfortable and I want to try, I already lose my erection. Then they get anxious after that. So and now we need to help both parties in the end. Yeah, even if at first they come as for vaginismus issue, but sometimes we also need to help make the partner more confident back as well. And then that's where all the sexual communication also comes in play. So a lot of things need to be
okay. Yeah. So I would just want to remind for those of you who are watching, if you have any questions at all for Andrea, please leave them in the comments wherever you're watching on Facebook or YouTube. So I was just doing some reading about this topic, and I came upon some like really surprising survey results about how a lot of women don't know their bodies. For example, 1 in 10 could not identify a diagram of women's reproductive system. Almost 25% thought menstruation is just shedding of excess blood from the body. So among many others. So in your experience, you did say that a lot of people, feel disgusted to touch themselves, to even look at themselves. So, but do you see the same pattern among men?
Yeah. So basically, like just now, I did mention a bit. So I'll just explain a bit more. So like even like just now you mentioned about menstruation, right? So like even for the topic about menstruation, about period, a lot of people don't even have proper education just about period themselves. Like I think how many of us here can actually tell me that they have proper education about period when they first got it? Because for me, I didn't really get any education. I just know that I bleed. Then I tell my mom I bleed. Then my mom is like, okay, wear this. That's all. And then like she didn't explain like how to why you need to use it, or like she didn't explain like how to choose a proper pad or proper sanitary pad, things like that. There's no education. We need to figure out it ourselves. We need to ask our friends, maybe older women, things like that, right? So basically, even for period, we don't have any education. And a lot of the time, people tend to have this perception that men know a lot about sex, but it's actually not that true. And it actually put a lot of pressure on men to do well in the bedroom. So that's why I do actually meet men who actually not aware that they need to erect or they need to be hard to have intercourse. Or some of them don't even know how to use a condom, or they do not know that women need to get aroused, need to get wet before intercourse can happen. And there's many more kind of perceptions. So it's not just women also having lack of knowledge. Even men actually have lack of knowledge in sex. And we don't always assume one gender is having more knowledge. Actually, it can happen to anyone. So it's all right to get educated. It's all right to get help to actually improve your relationship with yourself and your partner as well.
Right. So I think the part where you say, we need to get ourselves educated, especially when we don't have any trusted adults to help us, to explain to us. Sometimes, for example, I think even in the current situation, in our current community, I would say a lot of parents would not accept their kids having sex outside of marriage. They would still want it to happen after, because a lot of our parents are still very religious, right? So even if you want to talk to them, that would mean basically admitting that you are now sexually active, even before getting married. So obviously they will never go to their parents. And when it comes to getting educated online, unfortunately, they don't go through the right channels. They don't go through actual educational websites. They go to porn.
Yeah.
So what do you think is the adverse effect if you actually learn about sex from porn?
So basically, it's not, I wouldn't say like looking at porn is wrong, but what I would say is like, if you look at porn, you just need to know that porn is just like movies, it's just like shows, it's acting. Basically, all of them are porn stars. So they are acting, and then the scene that they give you is, of course, the good scene. They will give you the good scene, the good part. So they won't show you all the how to make the person wet, but they won't show you the foreplay. They won't show you all the intimacy part. They will straight, a lot of it actually just straight to the action, right? And a lot of it focus on maybe penetration or just orgasm, ejaculation, and things like that. So it's not wrong to see porn, but if you watch too much porn as well, you can get addicted to it.
Right.
How you get addicted is more like you depend on it as your arouser, basically. So you basically depend on the visual arouser instead of depending on touch. So the next time when you want to maybe explore your body, you want to touch your body, or when you want your partner to touch you, you don't get that same arousal because you're so used to the visual arousal already. So you don't get used to a real in-person kind of touch anymore. So I do have people who ask this kind of question before, where they say like, is it wrong to watch porn while masturbation and things like that? So for me, I feel like it's not wrong, but I will ask, is it affecting your sexual relationship? Are you watching it every day? Do you need porn every day to masturbate? That kind of question I will ask. So if you say yes, means that you are sort of like addicted to it, like you dependent on it. Not really addicted, maybe depending on it. Dependent on that stimulation to arouse you. So you can't depend on watching your partner anymore. Like you look at your partner, it doesn't arouse you anymore, things like that. So that's how it will affect your relationship and your sexual arousal as well. That's why some people say, how come I can get aroused by myself? Like they can get aroused masturbation, they can get aroused with porn, but why I can't get aroused with my partner? It's because of this, because we never explore the real connection with our partner. We only depend too much on the porn. Yeah. So when we don't get that same arousal, then we feel like, nah, this is not sex. The porn is the sex. Yeah. Things like that.
Right. Okay. So earlier you were saying you are specializing in vaginismus, but overall it is a sexual sex ed center. It's like sexual therapy center. So what other problems do people come with?
So because our center is actually focusing on women health, so a lot of the people that come to me is more couples or women actually with mainly vaginismus issue. But recently I do get other kind of issue as well, like I do have some people come with like maybe erectile dysfunction, or like more like sexual communication, or they do have like maybe orgasm issue or things like that. So like other sexual issue, but because we don't really advertise ourselves as like a sexual expert in other sexual issue, mainly vaginismus. So a lot of the clients that come to us only for vaginismus. But like I said just now, in vaginismus itself, there's many other things that's happening. There's lack of sexual communication. There could be erectile dysfunction as well for their partners and things like that. So end up, we are dealing with other things as well. Yeah, I am seeing other issues as well, not just vaginismus actually.
Right. Yeah. So when men come, I think I would say that erectile dysfunction is a very common and a pretty serious issue among men. I would say that would be the main concern among men. So how do you guys treat erectile dysfunction? Why does this happen most times? Is this also psychological?
So there's this talk actually from a doctor, I forget his name, but there's this talk last time I listened from a Chinese doctor who is actually quite specialized in men's health. And he actually says that for men, if you come for erectile dysfunction, you go to the doctor to see for erectile dysfunction before 40 plus or before 50 years old, it means a lot of the time, when they check, you are actually healthy. There's nothing wrong with you medically. So a lot of the time, it's actually psychological reason that could hinder you from performing or from getting erection. So like I mentioned just now, the anxiety that men get because people every time say, "Oh, you need to be able to get hard." Like men usually get hard easily. Why you
it's have the performance anxiety?
Yeah, so they start having performance anxiety because of that, which is actually quite common among guys. A lot of them feel like, and then sometimes when your partner criticize you, it's normal for both sides. If you hear your partner criticize you, like why you take so long to get hard, or why you take so fast, why you so fast reach ejaculation and things like that, it hurts our ego, it hurts our self-esteem, our confidence. Then like that's where the performance anxiety comes as well. So the next time you want to perform, you start worrying all these things, you start having all this thought again, like, oh, what happened if I can't erect long enough for her, or what happened if I ejaculate too fast and she's not satisfied, and things like that. So actually a lot of this can be related to psychological issue actually. Yeah, it's more to the pressure. Like it's more like the pressure and anxiety that we have. It's not like you have mental disorder or what. It's just you have anxiety towards it. And a lot of people get worried when people say, oh, you need to talk to mental health professional about this. People have this stereotype that, oh, it means I have a disorder, it means I'm crazy. But no, it doesn't have to be. It's just maybe you just have a lot of pressure or anxiety, performance, things like that. That is the one hinder your relationship in that. So we just need to deal with that, and we can help with you for that kind of issue.
Right. I think for so far we've been talking a lot in terms of very heterosexual relationships. So we have like two levels of problem here. Number one, we don't talk about sex often enough. Number two, it has always been about heterosexual sex. Of course, sexuality is fluid. There's many kinds of sexuality. Yeah. It can even change at one point and things like that. So have you ever counseled people who are not heterosexual, of different sexualities?
So currently, no. So I don't really have like personal experience seeing people from the LGBT community. So but we do learn about it as well in my master. So we do learn on how to communicate with them, on how to help them, and how to. So basically, that's where if you have a sex positivity, any sexual issue is you can handle sexual issue quite reasonably, in a more positive and more reasonable way. Like we wouldn't judge you. So that's one thing about like people who have sexology background or sex therapists. Usually we are more open and we are non-judgmental in terms of sex kind of topic. So that's one advantage of seeing a person who have some sexual expert or expertise behind. So because like a lot of the time, if you see other people, maybe like doctor, they also know about some of the medical issue on related to sex, but sometimes they are not comfortable to talk about it. So they wouldn't openly ask question related to sex. So that's one advantage. So for now, I don't really have any experience dealing with other, it's only heterosexual mainly.
Right. Okay. So I have a question here. I'm going to park it on the screen. So the question is, what about quickies? Is quickie healthy?
Okay. So basically, quickie is how I would say is like whatever activity you do, whatever sexual activity you do, if you enjoy it, if you like it, you like that style, you like quickie, then yes, quickie is good for you. But if you have quickie and you feel dissatisfied, you just feel like my partner only satisfied, I'm not satisfied, then there's an issue. That means you need to communicate with your partner, to tell your partner that quickie, it doesn't work for me. Like I'm not satisfied. Like I need more than quickie. Yeah, so basically just communicating it.
Okay, all right. Thank you so much, Andrea. So I think we've been talking a lot about sex positivity, right? So can you elaborate further on what sex positivity means? Is it just being happy with who you are, or is it about having open mindset about the kind of sexualities that are out there without judgment? So what does sex positive mean?
So someone who is sex positive means basically, like what I mentioned, they are open. You are open to learning more about your body, your own body, and understanding others people's body and understanding other people's sexual need as well. And you will also be more aware about consent, about intimacy, how to communicate about sex topic. Like instead of demanding, I want this, but you will actually talk to your partner about the sexual needs that each of you want to try maybe, or you want to experience, things like that. Like you won't straight away tell your partner, I want to try this, you must try with me, like things like that. And it also include like being respectful, basically non-judgmental, without feeling guilty, without feeling shame. So sex negativity, the opposite of sex positive, means that you approach sex in a very fearful way, oppression way, with stigma, and then you make people feel guilty and shame for even asking about sex topic.
Right.
So that's like the opposite. That's the difference between sex positivity and negativity.
I think speaking about sex positivity, speaking about communication, I think the best follow-up question would be, let's say for example, when you see partners, right, and then it is not often that we see that, okay, maybe majority of them could have like similar level of desires, right? Their sexual drive would be equal, so it'll be great. But that doesn't happen all the time. Sometimes depending on age and depending on where they're at in their lives, one of them might have a lower sexual drive than the other. So how does one navigate these kind of things?
Yeah, so that is actually also quite common in relationship, especially as we go longer in your relationship, as you grow older as well. Then you start having some differences, some maybe different sexual drives, different sexual needs, you want to try different activity, but you don't know how to go about it. Like you don't know how to start the conversation and things like that. So that's where I always emphasize on communication. So I feel like the most important thing in relationship is basically communication, but not just any communication, it's sexual communication. So you need to be confident, you need to feel like you feel respected, you won't feel being judged by your partner when you actually try to communicate about sexual related topic. So maybe like talk about understanding why there is differences between the sexual drive, or maybe like today you want to have sex, but then your partner don't feel like having sex. So instead of saying like, why you don't want to have sex with me, like you make me sad, making the person feel guilty, try to understand why your partner don't want to have sex. Like, is she feeling tired today, or is she just feeling a bit anxious today to have sex? Like things like that, communicate and ask, and then accommodate each other. So like if you still feel like you want to have some intimacy tonight, then maybe you can discuss, okay, maybe we can just cuddle together on bed, like cuddle together nakedly on bed. Like, I just need the intimacy together. Yeah. So sometimes actually our partner, sometimes when we think that we want sex, right, maybe we actually want the closeness, the intimacy with our partner. Maybe that's the only thing we crave actually, not really the whole activity until penetration.
Right.
So communicating about it, communicating about the differences, communicating what other things we can do. Because like, as you grow older, right, you can't expect both of you to still have very high sexual drive, or you can't expect you can get wet easily when you already reach 40, 50, and you can't expect your partner can get hard easily when he already reach like 40, 50 years old. So that's where we need to learn how to communicate, so that we can have a different way to satisfy each other. Because like I said, sexual activity you can have satisfaction from other sexual activity. It doesn't have to just be penetration. So you can always find other form of release for sex actually.
Right. So we were talking all this while about desirability and sexual drive and everything. So, but this also goes into, let's say for example, one of the partner wants to explore different fetishes or different kinks. So that also goes into the thing as well. But I think compared to just talking about sexual drive, I think when you want to tell to your partner that I have this fantasy, for example, they feel much more apprehensive to say it out loud.
Yes, correct.
So how does one go about, talking about this with your partner?
So I guess, what you say, like usually we're very worried that our partner, because it's like a fantasy, right, a kinks that we feel that it's out of the norm. It's not something that maybe our partner might not like. But have you asked your partner before? Have you tried talking about this topic before? Because sometimes we just think that, our partner not interested in it. But maybe if you actually try to just talk about it a bit, like maybe just ask about in general. You don't have to say about yourself that you have this interest, but you just ask in general first, just to see the reaction. Is it really your partner very view negative about this topic, or actually who knows, your partner actually interested, like, I also actually feel that this is something interesting. Then that's how you sort of see whether you can talk about it or not, or whether it's actually harder to talk about it. And that's where, if you feel like sexual communication about certain issue is a bit hard to talk with your partner, that's where you can do couple therapy or couple counseling to help a third person, an expert, to help guide you all to how to communicate about this in a more healthy environment, more safe environment. So at least you feel safer to express your needs to your partner without worrying about being judged and things like that. So if you feel like by yourself you cannot express it, even though you try so many times, but you feel like it's hard to do it, then you can always seek help, and we can always guide you on how to communicate with your partner. Maybe we bring your partner in as well, and we help you communicate your needs to your partner. And yeah, we try to help you to accommodate each other.
Right. So that is assuming that, okay, let's say I bring up the courage to tell my partner, and then we are assuming, okay, I just have to bring up the courage, and then hopefully he will say okay, or hopefully she will say okay. But let's say, for example, it is a deal breaker, like, no, I'm never going to do that. And that one could, because sometimes that could, in the long run, could affect the relationship, because, it is something that this person really wants to try, but the other party is saying no. So would a sexual therapist or a counselor help for them to reach, like, somewhere halfway?
Yeah. So any issue, not just for sex, even any other issue between couple as well, we can help you in how to find the common ground among both of you. Or maybe, we try to understand, like, why is it very important that you need to meet that sexual need of yours and things like that. So we try to discuss, try to work together, and find how to help both of you, especially if you really love your partner, you really love the relationship, you sure want to solve it, right? You sure want to do something about it. You don't want to break up just because of this issue, right? So if you really want to save your relationship, you can always try to seek help and ask help on how to deal with this issue.
Okay, so I've got another question. Not all women orgasm. Is that true or a myth?
Okay, yeah. So it is true and not myth. So why I say this is because, like, sometimes actually some women, they don't know about orgasm. They don't know the term orgasm. Actually, they don't even know that they don't even know that women can actually enjoy sex, can actually get pleasure, can get wet, can get orgasm, and things like that. So that's why a lot of women, they never experience orgasm. It could be because of that, because they don't know that there is such thing as orgasm for them. They only know, like, okay, guy will ejaculate, I just need to make sure my partner ejaculate, that's all. But they don't know that they also can have pleasure and orgasm. So that's one. And then the other thing is, sometimes when we don't, it's not so there's this thing that we think that we need to orgasm all the time, even for guys, like, guys think that they need to ejaculate every time when you have sex. That's also not really true. Like, you don't really need to have that every time, especially, like I say, the main thing is, if you enjoy your relationship with your partner, you still can get very high arousal. Actually, you still can get quite excitement. The excitement can be very high. Actually, it doesn't have to reach orgasm. So orgasm is your needs. Do you need orgasm or not, basically, in your sexual experience? Whether in orgasm, ejaculation, is it important? So some women, maybe they can't reach orgasm because not enough arousal. So they don't get enough arousal. It also very difficult for you to reach. So sometimes when you don't get enough arousal, a lot of us very shy to tell our partner, like, I haven't reached yet. Can you do more? Like, things like that. Sometimes we're very shy to tell our partner, so we just leave it there. We just hoping that our partner knows that we haven't reached orgasm, that they just need to continue. So we don't communicate to our partner. So that could be another reason why we didn't get orgasm as well, because we just assume that our partner will know how to do it. And the other thing is, we assume that our partner know how to pleasure us. So that's the other thing that is myth, because your body is different than their body. So they won't know where to pleasure you. They won't know where is your sensitive area, where is your arousing spot, and things like that. So you need to guide your partner. You can either tell your partner, or you guide his hand, or show it to him, like, do it here, do it there, like that's where it will make me more aroused. That's where I might be able to orgasm as well. And so
but then again, that can only happen if the woman knows her body first and foremost.
Yes, correct.
Right?
Yeah. So that's where, if a person never know that they can orgasm, then basically they won't bother to think about that, right? They won't think, like, oh, my partner need to pleasure me, or I need to orgasm. So you won't have this mindset if you don't know that you actually have the rights to orgasm. So basically, that's where the sexual right, like, you know that you actually have the right to ask for orgasm, or to get an orgasm, basically. So that is very important.
Right. I find it very interesting that so far all our conversation has been revolving around relationship. Like, because it's like, the sex and the intimacy goes hand in hand. But what about people who are doing, who are okay with casual sex or one night stands or things like that with no strings attached? How does one be sexually healthy or sexually positive, in a casual relationship?
So actually, it works the same way. Like when we say relationship, it doesn't have to be like committed relationship. It can be your casual relationship, one night stand relationship, friends with benefit relationship, whatever relationship you are having. The main important thing is, can you communicate with that person that you have a sexual need or you have certain needs that you want to satisfy during that night? Like if you do one night stand, right? Do you really want to have sex that night? If yes, then just go for it. Like just do it. But if you are not the one night stand type, you maybe need 2-3 nights only you can have the first sex, right? Then follow your body, follow what you feel like doing, and just communicate to your partner. If that person won't listen to you, like still demanding sex from you, then basically you know your sexual rights. You know your right as a person. It works both hands as well. Like even for guys, some guys also get forced to have sex, even though they are not ready to have sex. They don't feel like having sex. So it works both ways. It doesn't just mean for women. Even men get like forced to have sex on casual dates or like first night and things like that. So it works both way in committed marriage, in casual relationship as well. You need to communicate your needs and you know your rights. So like example, you want to have sex, but you want your partner to wear condom and he's not wearing condom. It's your decision to decide. Do you still want to continue this sexual activity with him if he's not wearing condom? So you decide whether you feel like, do you want to take the risk? So if you feel like you feel like you're okay with the risk, you feel like you can accept that, then it's nothing wrong. As long as you communicate, that both of you understand what's the risk if you don't wear condom, and what's the risk, what you get if you wear condom, like things like that. Basically, you communicate. Everything needs to be communicated.
Right. Okay. So I think since we're talking about communication and since we're talking about, the kinds of level of boundaries that we need to keep and everything. So of course we need to talk about consent.
Yeah.
And I think consent is a very, how to say, somehow some people still can't get it, what consent means. It is so funny because a lot of people try to give various kind of diagrams to explain what consent means. And I was watching this TED Talk about how they put similarities between consensual sex and offering someone tea. You wouldn't force feed someone a glass of tea or a cup of tea if they don't want it. Same as that. But the thing is, the person actually asked us back, how many times have we said okay for a cup of tea even though we don't like tea because we want to be polite? Or sometimes we go to a restaurant and the food is bad, but when they ask you how's the food, we say it's good, it's nice, the food is great. So we have been brought up in that culture of trying to be polite, of trying to not hurt someone else's feelings. So even the diagram of offering someone tea is still doesn't really help to explain to someone what consent actually means. So how would you explain consent to people?
I actually wanted to say that tea concept, but then after that, like what you say, it may not work in our culture because we are the type that don't want to hurt someone, right? We don't want to seem like we are disrespecting someone. So like even though people want to have sex with us, sometimes we feel bad to say no because maybe like they buy us food already, they buy us meals and treat us in hotel stay, right? So we feel guilty for saying no to our partner. So I come up with this idea. I'm not sure if it's worked, whether it's applicable for everyone. But but one example that I think of is like, example, if I want to eat spicy food, right? And even though I have low tolerance to eat, sometimes I do want to try it. Like I do want to try spicy food. So I will say, yes, I want to eat spicy food. But after trying it, I can say no to it because if it's too spicy for me, I have the right to change my mind. If not, I will end up forcing myself. I will end up make myself suffer and I will cry. Maybe I will have tummy ache after that. Or I basically, I maybe feel like I want to die eating the spicy food. So I think it's the same with sex as well. If you continue forcing yourself asking your partner to continue with your request, you basically like raping your partner or forcing yourself on your partner. So it's like a crime actually, and that is a crime actually if you have sex without a person consent. So it doesn't matter like if you're in a relationship or if you are married to that person. If the person don't feel like having sex with you, like you have the right to, you need to stop actually, and you have the right to say no, even like if you're doing halfway, like halfway having sex, right? And then you suddenly feel like you need to stop. It's perfectly fine to stop, because there could be many reasons why a person want to stop sex. Maybe they suddenly feel not well. Maybe they suddenly feel very painful that night, that particular night. Maybe they feel too painful, or maybe they just feel like you're not respecting me tonight because maybe you're just being too rough, or you didn't listen to what I said I wanted to do, like things like that. So the mood change, and you can't expect, or just because you're no more in the mood, I will still continue it. I don't care, like things like that. So that's where there's no more respect. So one thing about consent is it's also lead to respect.
Yes.
If you don't accept the person say no, means you're also not respecting the person actually. So for me, it's like you need to understand that you have the right to say yes, you have the right to say no, but you also have to understand that you need to accept no as well. So you cannot expect that I can say yes and no, but I cannot accept other people say no. So you also need to actually accept the no from someone else. And yes, of course, you will feel sad, like you feel disappointed, like why the person don't want to have sex with me? Did I do something wrong? I bought dinner for the person. Why you don't have sex with me? That's where you communicate again. So that's where communication come again. You talk to each other like, why not tonight? Did I do something wrong? Or are you not feeling well tonight? Like things like that. Like be considerate. There must be a reason why a person doesn't want to have sex with you. Maybe it could be like, oh, I'm just not feeling it tonight, or I'm not comfortable yet with you. Like for those one night stand, right? Maybe just like, I'm just not comfortable with you yet. I need few more times to meet you. Then only maybe we can have sex. So you don't have to force yourself to have sex with the person just because they bought you dinner or something. Yeah.
Right. Okay. So I think the final part would be at the end of the day, before we can even communicate, I think even to communicate, we need to have a certain base level of knowledge for us to express what we want and we don't want, for us to have a specific idea of what sexual relationship is for me. And for that, we need sexual education. Right?
Yep.
And it is very difficult. I don't even know if I had any in school. I don't think so. It's the basic reproduction thing that we learn in biology. And it's so funny because when we learn reproduction, we learn, especially for the female, we only learn what's inside the body. We don't learn what's outside the body.
Yes,
Somehow for the men is the same thing, but nobody knows what's outside the body for the women. So we learn the genitalia as a part of reproductive system, not a sexual organ, which is why a lot of women don't know that they can also experience pleasure. So what do you think should be included if there's going to be a proper revamp or a proper sexual education curriculum in schools?
Okay, so I'll just define a bit what sexual education means, because I noticed that a lot of people tend to misunderstand what sexual education means. Once they hear sex education, they will think like, oh, you're going to teach people how to have sex. Is there like what position to have sex? Basically, that's what people ask me when they first know that I'm a sexologist. They say, oh, so are you going to teach people how to have sex?
Right.
So yeah, so basically that's not it. Like we are not encouraging people to have sex. That's not true. It's basically sexual education is teaching people how to protect themselves, be more aware of your body. Like what you say, like in biology, we only learn the inside. So that's why a lot of people, when they have issue with sex, is because they only view sex as a reproduction system. So they don't view sex as a pleasure. It's not for them to enjoy. It's just, I need to have sex so that I can have baby. After I have baby, I'm not going to have sex anymore. Like that kind of concept. And that's where you will have sexual issue after that, because the concept of how you view sex. But for guys, a lot of them have different way of viewing sex, because a lot of them are more open to porn. So that's why they might have a bit more positive way of viewing sex, like, oh, sex is for pleasure. But for women, a lot of us don't dare to read up more about, maybe feel ashamed by it and things like that. So that's where sexual education actually help them to know your right as well, your sexual right. We even talk about puberty, body image, like we talk about consent, body part, like what you say. We don't know what's the outside. So a lot of people say vagina, but outside is not vagina. Outside is got vulva, we got labia, we got clitoris. There's so many things outside there that no one know this word. Everyone only know vagina, basically. They don't know. When you say, where's your vulva? They're like, huh? There's such thing called vulva. Like things like that, right? So that is important in sexual education. And we also talk about like healthy versus unhealthy relationship, identify good versus bad touch. This is for young kids, like naming the body part is important, because if you tell your kids that's your cookies, that's your flower, then next time when someone actually touch that and they tell you, mommy, someone touched my cookies, and you'll be like, oh, that's fine, you can share your cookies. Like you think it's a real cookies, right? But they're actually talking about that cookies. So that's why it's important to teach since young, even just by naming the body part correctly, so that when they tell you, they can tell you the correct thing. They tell, mommy, someone touched my vulva, someone touched my breast, like things like that. Like then you will straight away know what to do, right? And then the kids will get help instead of get traumatized. Like I have few clients who actually got traumatized because they got sexual harassed or assaulted since when they were young, and they don't dare to tell anyone about it because they just feel ashamed about it, and they don't know how to tell to their parents about it. So and now it become a trauma. Like after 20 years, then you cannot have sex anymore because you're so scared of that part. Like you feel disgusted of that part just because of that one incident. So that's why it's important to have sexual education. Like so basically this is why I feel like, and a lot of research actually found that comprehensive sexual education is beneficial for increasing young people's knowledge, improving their attitudes towards sexual and reproductive health. So usually in a sexual education, it's not only sex, but it's also about the reproductive. But at least we actually combine them and make it into a more healthy way of looking at it, and on behavior. We even talk about contraceptive, like how to prevent yourself from getting pregnant, STI, HIV, STI, HIV. So this is based on UNESCO. Actually, I found this like explanation from UNESCO. Like this is basically what sex education is, not those things that we think about. So it can protect. It actually can protect your kids or young people from dating violence, from being bullied, from being abused in a relationship, because when they know what is a healthy versus unhealthy relationship, then they know like, okay, this person is a toxic person, is not respecting me, I should not be in this relationship anymore. Like once you know all these things, then you will know how to protect yourself. Mainly is to help people to protect themselves.
Right. I think that was like the perfect concluding statement for today's show, because at the end of the day, it goes back down to education, and it doesn't matter where you get that education from. But I think a lot of people think that, okay, like what you said, sexual education, people seem to think that it is how to have sex. But and a lot of people think, okay, if we just push it somewhere that I can't see, it's not going to happen. But people are going to have sex whether or not you talk about it. So I think it's always better for them to do it safely than, and then end up having, children out of wedlock. And that's going to be just continuous social problem as well, because women, underage women getting pregnant is not going to do any good for the baby or for the mother as well. So I would like to also just tell to the audience that, okay, if you'd like more information about vaginismus treatment, and you like to have any kind of consultation with Andrea, you can go on to Vibrance IG and Facebook page, My Vibrance. So if you have any issues at all, you can go there. You can head on there to get more information. I think it's very important to talk about vaginismus, because a lot of people used to think, I don't think people thought of it as an issue. Because, like what you said, it was supposed to be painful anyway. I think this is the pain that I'm supposed to experience.
Which is sad. Some people have that mindset as well. And like some couples, like we have couples like after 3-5 years only come and seek treatment because they feel like it's a common issue. They feel like it will get better, like the sex will improve. But actually what happened is they just have no sex anymore after that. And when times come, like time clock ticking, you want to have baby, that's where then only they start thinking again, okay, we need to have sex because we need to have baby. So yeah, so that's why it's important to talk about it and to seek treatment early. Like don't wait until like 3-4 years later, or yeah, when your relationship become less
deteriorating, right?
Yes.
Yeah. And also, again, when it comes to education, it also goes back to how you being empowered with the education that you have, which which results in, you know, healthy relationship, healthy sexual relationship, knowing your boundaries, understanding what is consent, understanding what is the bad behavior, bad practices that you don't have to put up with in a sexual relationship. So thank you so much, Andrea, for spending an hour with me. I think it was very, very enlightening. I hope those of you who are watching are also finding it enlightening. Yeah. So, and thank you so much for the comments. And yeah, thank you, Andrea, for tonight.
Bye-bye. Thank you for inviting me. If you have any question, you can find me at Vibrance.
Right. And also, you also have your own Instagram page, right?
Yes. So they can follow that as well. The IG, the Secret Talk Andrea. So they can also find me there for more to sexual knowledge. It's like I just do some sexual education posts there. So yeah, they can join me there as well.
Okay. Thank you so much, Andrea. Have a good weekend.
Yep, you too. Bye, everyone.
Bye. Okay, thank you so much, guys, for listening. I hope you enjoyed the show. So don't forget, you can like, subscribe BKNI Resources YouTube channel. You can find all the episodes there, and there's also a Spotify channel. You can also find that there if YouTube channels are not your thing. And I will see you guys in 2 weeks. Have a good night. Stay safe. Have a good weekend.